The reproductive system is obviously the most complex part of the human body. Both male and female have different reproductive organs with different functions. Hence, they may experience different health challenges. In today's episode, our guest will educate us on some various health challenges in adolescents. Welcome to HEALTHLINK TV show. This program is proudly sponsored by Frito Vegetable Oil, Indomie Instant Noodles, Cerelac, Pepsodent, Close-Up, Ocean Sardines, and Amok Ventures. Let's go for a breather. When we come back, we'll start our discussion for today. Welcome back. So today I have with me Dr. Benedict Afari from B&J Medical Center, and he's here to educate us on some common reproductive health issues in adolescents. Doctor, you're welcome to HEALTHLINK TV show.
Thank you very much.
It's a pleasure to have you here again.
Yes, I'm also glad to be back.
Great. So, Doc, who is an adolescent?
Okay, so an adolescent is a male or a female between the ages of 10 and 19.
Okay.
Yes, so anybody between the ages of 10 and 19 is classified as an adolescent.
Okay.
Yes.
And what are some of the common reproductive health issues in adolescents, specifically those in Ghana?
Yes, so if you look at the adolescents, they are actually a period that is between childhood and adulthood.
Okay.
So it's more like a transition. So they have problems that they were having when they were children, and now they are transitioning into adulthood, so they have the issues.
Doc, before you continue, I want to know whether that period is the same as puberty.
It's not the same, but puberty will happen within that age group.
Okay, okay.
Yes, so you have adolescents going through the period of puberty during that age group. And sometimes you may have somebody having an early puberty or somebody having a late puberty, but usually it happens within this adolescent period.
That is 12 to
10 to 19.
10 to 19.
Yes, yes.
Okay. And what are some of the common reproductive health challenges?
So most of the problems that occur in these adolescents has to do with their development. So they are having physical development, they are having cognitive development, and these bring social and behavioral changes.
Doc, let's calm down, okay? All right, so you mentioned social and cognitive developmental changes, but
Yes.
Can you translate it to our local parlance so that someone can understand?
Okay, into adolescent, age 10 to 19. During that time, nyoma bebre si omo abrabam nti omo develop ofamba na afi na omo develop breast omo no for no bobo afi na inhwi na ewo omo motiase no ne omo ase no eba ufa mema no so at that time na ohun se omo nyi omo ya atenti bo so omo voice a breaking so omo nya deep voice and at that time so na ya na omo penis develop any omo testis nya develop into we no physical development.
Okay, so during that time, no problems being mostly omo experiencing when it comes to their reproductive health.
Good. Into this time now, because it's here no more develop a different secondary sexual characteristics no. It's here hormones na wo mu na ejuma into omo besha se at enya atinka. Once omunya atinka no so a one way ya na sa time na ombenya exposure with the opposite sex. It is during that time no more forming relationship. It is most likely say they will initiate sex until that time na have sex. Into most of the time they may go into sex around that time. It is team go into sex as well. With sex comes with pregnancy.
Okay.
Into you get early pregnancy in most of them. And I say biomenya these sexually transmitted infections. Even sometimes HIV cry ombetiminya. And I want that time no so many see a shape until they explore and exploit so many things into apart from say or more engage in sex any other behaviors no. What for boys in this area they engage in very risky activities. So that time na ebinum be started smoking ombe start ensanom nti saa nneoma we nyina so omoye a ebema omonya inyarewo bebre.
Okay. And you mentioned cognitive, like
Yes.
ahono betimi acheche mu kakra.
Nti won say adolescent period no, even though say physically no omo nyi nti bibia ewo obi a wenyi ho ewo omo ho, but that time no omo adwe no afei na developing to be say most of the time no physical development in the ba first. Answer na cognitive development so omo brain nti because of that they are very vulnerable. Into physically they look matured, especially the ladies, you know. They look matured. Into most amount from home say, hey, why pain you? Say bonofo. Those things, and especially the women, no, and I say enkrano, adolescent females, you know, they get attracted. Into both say men get attracted to them because now they look so matured. But that time, you know, omagening develop in a way or make me take certain decisions because of that, you know. Most of the things no more, you know, dream who be brave.
So money so oma society
exactly, good. And during that time, no, so tea for peer pressure. Very high during that time.
Okay.
Especially in the area, feel say I will follow into me any opportunity say be church and man and answer man and no be go through during that adolescent period na church training na ombeje free omonamfofo ho nti so moje free omonamfo na am the right information and the right education, not just they will fall into bad company.
All right.
Yes.
Okay.
Nti sanity.
All right, doc. I heard say mostly candidiasis and I say look I'm friend of white no aya na ewo emba ho adolescents then a deba who sa den wo adolescents ho.
Say candidiasis the strictly any sexually transmitted infection.
Okay.
It's mainly hygiene. And I won't say ma omo ase ho no ye wo ade be friend pH. It is a pH no sesape. Now bon say embo no omo at senti ye wo ade be friend good or normal flora.
Okay.
Ewo omo ase ho e protect your omo. Anytime be a true personal hygiene and the use of washrooms used by other people, and as sometimes certain practices say be during menses time and I say be almost see certain parts be and I know be to me predispose them to candidates because once at that time no personal hygiene is not the best. And menses so the way keep your Inti saa nneoma we ne bia na baby omo school for example school omo use washroom together. Inti bia na o use obi sapo use obi towel
and so share.
Exactly. Inti say omo ye saa nneoma na betimi amomo nya saa infection no.
Doc, me person me who say me fan say adolescents be or ho na say or reproductive health issues better than when who say oh this adolescent is having this kind of reproductive health issue and that's be atochima e won reproductive system no.
Good. Into when some start make say omudru adolescent period na your physical development and development of the secondary sexual characteristics no.
Okay.
Into so omu the way normal one not here. Inti ba no mu because most of the time we need the way a normal one is here is ba hu inti yemfa say vaginal discharge say we say normal vaginal discharge inti so munim say okay normal vaginal discharge na ya white pampan ni maybe our sink account to mu say bia na discharge na finance ba na nsuo na finance ba na bia na color na sesa ana sesi asenti bia be mu ana na sika na che say wonya infection bibisa ana say bia ohun say sesi ano wenya pains bi wona say na sane mana no ne chese bia na problem aba.
But doc be matuminya white ana
technically the member nya white because of the way a reproductive organ no esitie. Inti women are more prone to candidiasis but men can get candidiasis but not the way a man
different like how will you know say bema and bema bi o he be na when so obi
inti men most of the time say infection na men man be especially so be you have sex with or bar or infection abon say almost start almost betimi nya discharge and men man betimi nya urethral discharge and as a burning sensation especially so junso
okay
and also and as be obon say bibia be sisi ne bema no ho nti ohun sa ne ma na say infection but eno no depend because infection no does nti just say bia omoko hospital na ehun say okay o infection no this one and that one na ehun edru a ye de bema no and my main say most of the time no say education and ho omunya some of this infection na so wakọ e bia drugstore wakoka se o mehu se bia na me dwunso ana me bema mo hihim nti bo so mama edru but e bia na ya man with the right edru a ebema yes infection nako yes and I want say about the same reproductive problems na adolescents no munya no most Ghana health service facilities say wade be an adolescent corner because you who say an adolescent no mo hospital mo ferry and also more problem the way even sometimes health professionals no ombe approach you no ombe say bia na wakonyi nsen but the ombe ka say bia we akwa boni exactly nti na most of the time we more preference and I encourage almost say adolescents who problem bia both the males and the females and a man nyina who any problem concerning your reproductive organ who changes bia na hospital say wo Ghana nyina obetimi akọ ma ya hwe nti eni so mo ferry so we bia na mo kokan ye be koka cha mo parents e bia me hu ba no wa ba ha se o se onyem ana se bibibi say but ye pese ye encourage adolescents ne say services no wo ho nti they shouldn't feel shy problem bi o mo bia no o mo fambra hospital ye wo train health professionals betimi no mo akasa mo advice sometimes even contraception kra no ye betimi de amom even though eno no na a bit technical but these are services I betimi de ama adolescent.
Doc, I want us to talk about some of the complications that can occur when an adolescent is having a reproductive health issues. But before that, viewers, you are watching HealthLink TV show. This program is proudly sponsored by Frito Vegetable Oil, Indomie Instant Noodles, Cerelac, Pepsodent, Close-Up, Ocean Sardines, and Amok Ventures. Let's go for a quick break. When we come back, we'll continue our discussion on reproductive health issues in adolescents. Welcome back. So before we went on break, we were talking about certain reproductive health issues that occurs in adolescents. But now let's move to some of the complications that can arise if adolescent is experiencing any form of reproductive health challenges.
Okay. Into offer infections, if you take infections, if an adolescent gets an infection, it can cause issues such as later years, they can have pelvic inflammatory disease. For example, someone is sexually active. Into all the sexually transmitted infections, some bits may pick it up once they are having sex. And when they pick that one up, sexually transmitted infection, it may develop into pelvic inflammatory disease. And then on one here, no one treating later in life, a bit may cause tuber blockage.
Wow. Me pacho pelvic inflammatory disease, no. What is it about?
And no choice when your infection as no affect the womb, any tubes, sometimes it may affect the tukusiano. Good. Into most of the time, with tubes in bit me are blocking. When your tube blocks, that means getting pregnant will become difficult later in life. Into one way I would say, obeying now our worry na infertility has set in. Na obey hospital bebre, but we say because of infections na time no adolescent na emano instance so that at this material moment why adults one. And when they get pregnant, for example, most of the time they won't say it, control beer, so they may attempt to do abortion until it will end up in unsafe abortion. Now, if they go and do an unsafe abortion, it can cause infection, one, and also you can even get perforation of the womb. Yes. And sometimes it could be that bad, a bit me infected intestines.
Doc, this is a very critical issue. Some person will come back now is plenty perforated, kind of saying womb, so that obi sure better say.
Yes. Into the me patch and say adolescents no so much insane. Na because of pay and an unwanted pregnancy and unintended pregnancy, most likely no attempt to say abortion. And because of one case no country be no musunti, omukwa koya de be friend on save abortion.
Okay.
On save abortion interest, either say oh yeah, nipa kwa or yeah abortion or nye qualified so be and in training so be. And I say bibia or yeah abortion and ye bibia so yeah abortion. And I say instrument no the yeah abortion and yet the right instrument.
Okay.
It is all koye unsafe abortion. Obetimi nya complication e friend no perforated uterus and perforated when it just say womb no tokro betimi abetomu.
That's a bit affected pregnancy.
Good. It is a tokro beto womb no mu infection baba.
Okay.
And as a womb na wan hwe ni ya entimi nye edwuma ese eye later in life. In ebi ho kra na sa perforation no kra ma ye koye no operation.
Wow.
Yes, sometimes me end in operation because of perforation, because I say ekona ekosi sa tokro na abeda womb no because anya sa na akora no onya infection na yen treat ya obetimi ewu.
Okay.
Yes, actually people have died from unsafe abortions.
Wow.
Adolescents and even adults cry.
So, Doc, if I say adolescents be enyim sesia,
Yes.
like what advice will you give to the person?
In this adolescents ebia sisi ano akoye na wanyem no. Ese
Okay.
o catch your parents.
Okay.
And na how catch your parents and say oba akonyem na waba eni so ye ni hehe. Ese ode no ba won chen. Ade na de ebisi no esiewie untimi nya bibia amfa ho. Nti ese wo na sisi ano ode no ba won chen na ode no call hospital. Ode no call hospital depending on the situation no. Health professionals no be advise you on the best way out.
Oh, okay. Okay.
But one observation I mean when say yeah most of the adolescents because they are no more hiding in tombe bana nyinsa na konenim obi ba na onya 5 months 6 months into yes that time na so attempt to say obi terminate that pregnancy into there are some adolescents e bitimi agade omo akopem say omo ankasa ombetimi awo then they can continue with their education. For example, also there have been cases say because of pregnancy inti ebia omo parents cry asake omo afifie and na school cry asake omo basa nyomo ni nyina is against the law.
Wow.
Bibia ni ho say adolescent bi nyima the laws are there be protect adolescents say betimi ahwe na akopem so bewo.
Is it working in Ghana?
Yes, of course the laws are, we have policies that are there manage all these issues.
Because I know a lot of adolescents who are just walking around with pregnancy with no support.
Exactly. But it shouldn't be like that. It shouldn't be so because there are a lot of policies and laws in the country that protect adolescents. Just that implementation is a problem. But they are there. In the adolescent, it shouldn't be sacked from the house and now school.
Okay.
Most of the time, now the problem is the school.
Okay.
Because the way stigma, yes, but there's nothing like that. Once adolescents are fit enough to go to class, no bit me they fine. Say be not pregnancy na untimi nsuande ana or yarete be that's okay. But then yes, if the adolescent is stronger, the laws and the policies are there to protect the adolescent. So say you be training through the pregnancy now. I'm not saying I'm encouraging teenage pregnancy and pregnancy in adolescent, but say a single there we have to protect the adolescent and make sure say or is safe.
So me fan say parents no per se akwa ne beba fi adolescent beba fi then onye.
We say we are supposed to have a social welfare system.
Okay,
even though it's not, in terms of operationalization, they're problematic, but there's supposed to be a social welfare system that's supposed to cater for that adolescent. But of course, as a parents, we need to educate them because most of them they don't really understand what is going on because they are thinking about what people will say about religion. Maybe I know also a suffer. So for the head, say no. So they are thinking about their religious beliefs. They are talking about what the society will say. And as because of that, they will sack their children from the house. But no, they shouldn't do that. There are times where I suppose say, "Akrani the news and the Bombay so village, na kotina village, or kotina or grandmother." But all those things are not good. I say it to me. you didn't cry by and chain. Because that period is not easy. Because adolescents nankasa a lot of changes no mo go through nankasa and it's not easy for them. In Sisiana pregnancy abeka hono, that is not the time we need to ostracize them and now say we have to abandon or neglect them.
Okay.
And say they go through the pregnancy period safely so that they can also achieve what we call positive pregnancy experience. Yes.
All right, Doc. So, you mention of a man or more experience, say, pelvic inflammatory disease,
Yes.
and I say other infections.
Yeah.
What about the males? What are some of the complications a bit arising from
Yes.
reproductive health issues?
Yes, so a man also, so musunya infection a bit me momunya, a bit me a blockade or quina or mojunso femuno. And also ben to me so later in life also or mania infertility. Because infection bit me could damage or more testis and acid form and also bit me a homo. And I will say member also make about alcohol, smoking and acid form and also have health implications.
All right.
Because if you are drinking alcohol, you can have certain diseases that will affect the organs. Maybe if you go and smoke, you can have some respiratory tract infection. And men also, and I would say a lot of the men they involved in this violence and all that, so they can get some injuries.
Okay.
And when you get an injury too, it can have consequences on you later in life.
All right, Doc. Before you leave, what do you have to tell any adolescents out there watching this program, as well as their parents?
Okay. So for the adolescents, we appreciate the changes that they are going through. It's a very special time for them. So whatever problem that they have, they should seek advice from the adults. Okay. Then for the parents, we encourage the parents that they should talk to their adolescent. They should educate them about some of the changes that they will go through, sex education, and their experience. Sometimes the parents should actually share the experiences that they went through when they are also adolescents, so that it will guide the adolescent to be able to make the right choices and take the right decisions, so that they don't involve themselves in any risky behaviors that will have consequences for them in future, and they can enjoy their adolescent period.
All right, Doc. Thank you so much for joining me today.
Yes, thank you too.
Viewers, thank you so much for watching HealthLink TV show. Join me same time next week for another amazing episode. HealthLink, everything on health.